All right, everybody, and welcome to another episode of the Future Ear Radio Podcast. I'm thrilled to be joined today by Dr. Tish Gaffney. So, Tish, thanks so much for being on the podcast. How are you doing today?
I am doing great. Thank you for having me on.
Absolutely. Well, thank you so much for coming on. But wanted to have you on. You are heading into 2024. You'll be the president of the American Academy of Audiology. You're a professor at Nova Southeastern in Florida. You got a lot of different titles and things that you're focused on right now. But I wanted to go back to the start, like I do with most of my guests on the podcast, to just kind of get a sense of how did you come into this space and more or less discuss how you got to where you are now. So let's go back to the start.
Sure. So I had always loved science and healthcare, and I knew I always wanted to do something in healthcare. I thought maybe doctor. I thought, all these different things you do when you're in, high school and those early years of college. And I really discovered audiology from my uncle, who was an ear, nose, and throat physician. And during the summers, I kind of go down to his office in Delaware. I'm from Philly originally, the suburbs of Philly. And so I would go down to Delaware and kind of help out, like filing and stuff like that. But his audiologist would let me observe her. And it was really a great opportunity to kind of see how ENT functioned as a physician versus how the audiologist gets to function and have that more interaction and personal care with their patients compared to that, more fast-paced physician approach. And so, when I was in college, I decided to do speech and hearing sciences. I was doing my undergraduate at the George Washington University in Washington, D.C. And then I went to the University of Pittsburgh for graduate school. And when I entered into grad school, it was kind of in that transition period where there were some AUD programs, some of the early ones. Most of them were still masters. My undergraduate advisor was like, yeah, we're not sure if the AUD is going to work out, so don't apply only AUD, apply half and half. And I was like, okay. And I ended up getting into the University of Pittsburgh, which is a great school. And at that time, it was still a master's program. It wasn't an AUD yet. And I decided to go. It would have been in-state for me, so it was a great opportunity to go to a great school. And my first year there, they're like, we're going to transition to the AUD. And I was like, well, this is great because I kind of wanted to do the AUD anyway. And so this was a great opportunity. And so I learned a lot at University of Pittsburgh, and I, have a great relationship with a lot of the faculty who taught me then. I ended up doing my externship at the VA hospital in Miami. So that moved me down to Florida for my externship. And I graduated, they offered me a job, and I stayed there for a couple of years. And then right up the road here in Fort Lauderdale, Nova had a position open, and I decided to apply. It was 2 years after I graduated. So I graduated in 2005, and I ended up starting here in 2007. And so being very young and new to the profession, stepping into a faculty position was interesting and definitely a learning curve, from being that student to now being that faculty member. But I thought, my interest has always been vestibular. And so I thought that I could really, lean into that in this, role at this university. And so it's been great. I've been here 16 years, still here. And I have had the luxury of, being able to build our vestibular program here. And we could talk about that later. But kind of in tandem to that, I was always interested in the professional side of things too. And so when I was in school at Pitt, my first conference was the Philadelphia conference, which was great for me. My first year as an AUD student, I got to go home to a conference. And that's when I learned about NAFTA, which is the National Association of Future Doctors of Audiology. And that was an organization that was specifically designed to help promote the AUD because it still was in that transition period. And so my classmate and I brought it back to Pitt, and we started our NAFTA chapter there, which put me on the national representative for Pitt on the national board for NAFTA. And from there, my professional kind of career took off too, just getting to know tons of people and then rolling it to an executive position. And then I have basically volunteered the whole rest of my career for various committees and organizations. So it's kind of had these two things between the my day-to-day job, but also my volunteer life has kind of really stemmed from that University of Pittsburgh experience kind of in both ways.
It's interesting that, like I've had this conversation a few different times on the podcast about this like whole period when it was kind of the Wild West, when it was transitioning from the master's degree to the doctoral. And I just think that's such an interesting wrinkle for a lot of people that are in this profession, is whether they started before the transition existed, and so they're all like master's degree, and some of them, afterward they went and they got their doctoral. Others, they didn't have an option. Really, the AUD was the only one that exists. But I just find this to be, it's part of the whole story of what is still kind of a nascent profession, I think. And I think it's interesting that we're kind of at this crossroads in many ways as an industry. And I think audiology is, in particular, is kind of identifying what is the role into the future, given some of these changes that are happening, some of these different external pressures and all that. But so that's one thought that I have based on what you said. But the other is this pattern that is now very visible, I guess, from the guests that I've had on the podcast, that have really sort of leapfrogged in their career by putting themselves out there, getting involved in whatever way they can. And it's obviously dependent upon the circumstances of when these opportunities present themselves. Like you said, you kind of had this opportunity come about that was for young professionals that were to more or less represent the new doctoral level degree. Whereas today, those might take different shapes. But I think that the kind of the pattern is that if you're willing to do these kinds of go above and beyond just the norm, it seems like there's almost undeniably going to be some positive sort of secondary order effects that come from that.
Absolutely. And, my involvement in NAFTA, which, for some of the young people, they don't even know that existed. And, that's now basically what SAA has become due to some agreements that took place many years ago at this point. But yeah, that was truly the catalyst for so much of what I've done. And actually, even just getting my job here, it was super helpful. So, when I was a student on the NAFTA board, so the way that NAFTA functioned, which is a little different than how SAA functions, was that because there were so few AUD programs, every AUD program had a board member. And so you were the national representative for your chapter, for your school. And we all met. And so, I just found actually the 1 year, both years I was on the NAFTA board, I was in charge of the conference, either on the conference committee or as the secretary. The conference fell underneath it. And NAFTA had its own conference the day before AAA. And I just moved. And so I was going through an old piece of luggage that I had, and I pulled out, and there was the room list, because we paid for the rooms.
Yep.
And we put 4 students in a room. And I found the room list, and I was going through it. And I was the number of people who were involved at that time who are now really successful, either, through their state academies, through their professional organizations, industry. There's so many people on that have done so much with their career. And it really started with doing stuff at that student level. And, if you kind of get into that mindset that you want to be involved, you want to give back to your profession, because you don't get paid anything, right? And so it is your time that you're paying to participate. You do get to having really enriching experiences with colleagues from around the country. I could pretty much go to any city and know somebody there.
That's
from
really cool.
All of the time that I've been on, involved in my profession. And so it's really, I mean, it has really, that has been such an important part of my journey of, starting at that point in my, student years of really being engaged in, knowing people and things like that. And, at heart, I'm really an introvert. So for those introverted people out there, like I am truly like at heart an introvert. However, because I've made so many friends in audiology, I've been able to, so people don't realize that. And they're like, oh, you're so extroverted. How would you be? But like audiology is like my home and they're all my friends. And so it's become really easy to, kind of blossom in that way throughout my career from, my 20s up until now.
Yeah, I mean, I just think it's really important because like to your point, you don't get paid. So it's not like you get like these super tangible direct benefits, but to your point, you sort of reflect back. And I think many people can sort of, they can relate to this because they've had similar things happen in their life, which is, again, just a testament of like, just do more, especially when you're just getting started out, because I think it's just going to lend itself to you, like, giving yourself more opportunities for like serendipity to happen, for luck to happen, for you to kind of meet that right person that is going to be, some sort of colleague in some capacity down the line. You don't ever really know what's going to happen. So like, I guess to just real quickly going off a tangent with this, as a professor, as somebody that works with a lot of young people, and then as the president of AAA, what would you say to people that are, kind of young now? Like what are some of the specific ways that you can get more involved? I know, you can join your SAA chapter and all that, the student academies. But like, is there anything that comes to mind in terms of ways that you think you as a young person could like set yourself up to be successful by kind of like going out and about and doing things that are maybe not as, cut and dry as just following your curriculum?
Yeah, volunteering for, SAA is a fantastic way to start. But there's other organizations out there too. And, I've had several students who have become board representatives to the American Balance Society. So they're getting leadership from that role. Once you graduate, those first couple of years, volunteering either at your seat academies, your, national, professional organizations like AAA, ASHA, ADA, or more specialty ones like Balance Society, or if you're a VA, employee of the VA audiology group, or, so there's so many organizations, which is a give and take in the profession, right? Sometimes it's a great thing, sometimes it's not. Yeah. But, when you volunteer and you show up and you participate and do the work, when they're looking for people to do the next thing, they say, oh, so-and-so is really great on this committee. We should ask them to be part of this. And that's really what happened. And I've seen that snowball, especially within AAA, because I've been so involved in that organization for so long. You absolutely see that happen. People who show up, participate in the meetings, and most committees are not overbearing amounts of work. They're monthly meetings, maybe some work in between. But when you really participate and not just sign up and sit there, when you actually participate, people remember that. And people say, and I was just literally talking to one of my friends, and she's like, do you know so-and-so? Because they're on this committee, and I think they were on one of your committees before, and they're doing such a great job. Like, they would really be good in a board position, or they'd be really good as a committee chair. And so that's how that snowballs into these higher level, positions. I mean, there was periods of time where I was on like 5 committees at once, and some are more amounts of work, some are less, and, that's how you kind of build this is, when people ask you, you say yes, and you put effort into it. And it definitely pays off for sure.
Yeah, I couldn't agree more with that. So, thinking about your trajectory, so you get your AUD, you're kind of one of the first generation of the new doctoral level graduates, and then you go and you join down at Nova. What was that like? You had said that it was like you kind of almost were maybe thrust into the lion's den or something like that. It sounds like you were put outside of your comfort zone, which is another kind of, testament of personal growth is, being uncomfortable as to kind of grow your comfort zone?
Yeah, I mean, I think that being a faculty member is an interesting position because you play so many roles in it, and it's not just the teaching. There's other responsibilities too. But if we look at this, so I became a faculty member at, I think, 27, 28 and around there. And I was only 2 years out of school. My students were my same age, they were, a couple years younger than me. So having to create an authority type role, and I don't mean that in a negative way, but, in a way that you're in charge of your classroom and you're in charge of this homework, but also being so close in age actually it's a little bit of a struggle, because you're like, oh, these are my peers because they're so young and they're doing the same things that you're doing because you're so young. But then having to, create this academic persona in order to, effectively lead them as their faculty member. And it took some learning to kind of develop that. I've always had the same philosophy the entire time I've been here, is that I'm very clinician forward. So, what is it that clinicians need to know when they go out in the world? This is an AUD. This is a clinical doctorate. What do clinicians really need to know when they go out into the world as a clinician? The other thing is that, and this is something I get consistently on teaching evals and things like that, is tough but fair. So, I have a standard of where I expect performance to be. Here's what I've taught you. Here's the tools I've given you. I expect the student to put in their work, studying and learning the material. Here's where the bar is. I expect you to hit that bar, but it's also fair. I don't like pulling obscure things. Like pretty much every exam question I can pull exactly from the slides where it is, because it's not meant to be tricky. I'm not trying to trick people. I don't want to, sabotage students, but, I think I feel like there has to be a bar that we're attaining to this. So, and creating that and defining that over time is something that took some time to really establish. But I love what I do. I love teaching students and being able to see those aha moments when a student finally gets it, or they finally understand how those pieces fit together. I love being in the classroom with them. And that was something that took some time to learn too, is that you're a student and maybe do a 15-minute presentation. Well, now here you're expected to teach 3 hours at a time and build all that material from scratch. And, that takes, it takes refinement to also be able to teach effectively too. So yeah, that journey as far as a faculty member, took time to finesse. I think I've gotten it to a place where I'm good with it. This year I was awarded the AAA Outstanding Educator Award. I was nominated by 2 other faculty members, and they had, some of our former students also write supporting letters. And, I look at where my students have gone and what they've done. And that's always the testament to how good you are is, what the product that you produce. And your product is in this case, is a student.
Yeah, I've met a few Nova Southeastern students over the years, and I can agree to that. Yes, some very impressive graduates that are doing really impressive work already in their young careers. But I was going to ask you, first off, congrats on winning that award. That's really cool, and that's got to be extremely gratifying. So as somebody that's kind of been teaching, you're kind of on the front lines of seeing, like whatever kinds of trends I think are developing within the younger population, the future generations of the providers, some of which are, kind of maybe well-established in their careers now. But my point is that I feel like you, maybe more than anyone, would be kind of seeing where you think people are like, where the workforce is trending toward. What changes are you noticing with recent grads today and students today that you're seeing that might be different than, say, a few years ago or 10 years ago? What are some of those market changes that you feel are noticeably different?
I think that So there's a bias towards what I think as far as like within my specialty, and then there's kind of an overall. Um, I think that there has been some disruption to, you know, the audiology marketplace, right? And there's all these concerns about various, you know, ways in. And I've seen students take more innovative approaches to how they're providing care or their business models. And I think that that's going to continue to change. I think people are going to start thinking outside the box than the traditional, you know, I'm going to go work for an ENT. I'm going to go work in a hospital. There's been, you know, definitely some differences in how people are, you know, kind of going out there into the world. You know, within my area of expertise, which is vestibular, there's absolutely been a change in, you know, the acceptance. I don't want to say acceptance. Kind of how involved people are in vestibular since when I was a student to now. And, you know, when I was a student, there was very few people who did vestibular, and who did it, you know, well, and that was their expertise. You know, there was vestibular's been around, right? And, you know, people were doing it. But I think this true interest in vestibular has really changed quite a bit. When I was in school, nobody talked about pediatric vestibular at all. Like it pretty much didn't exist. Yeah. And so watching that develop over time has been really interesting. All of the new technology, like when I was in school, the VEMPs didn't exist. Actually, they were just starting to be talked about. A lot of the early VEMP literature was in the early 2000s, right when I was in school. But, you know, that was really CVEMP, and then OVEMP didn't exist, VHIT didn't exist. So, you know, watching that develop has been really interesting. And, you know, students being interested in that has changed. You know, when, like I said, when I was a student, nobody really talked about vestibular that much. It was kind of this very specialized thing. It was part of somebody's course. It didn't have its own curriculum to a large extent. And, you know, now when I go to AAA, I presented vestibular grand rounds. I think it was not this past year, but the year before.
The St. Louis one.
Yeah. And I asked that room, you know, there's 200 and something people in there. How many of you guys are students? And I'd say 80% of the room raised their hand. And that interest has really grown. I have students I know you've talked to with like Liz Femler and Anna Romero, and they have their Dizzy podcast. And I have students who come to me and they're like, so I was watching the Dizzy podcast and they were talking about this, and they were talking about rotary chair, and we have a rotary chair, and it fuels their excitement for that. And part of that is also, you know, who's teaching it, right? So if you have somebody who's interested in vestibular, it's easy to generate more of that interest. But that is one thing that has absolutely changed over time, for sure.
That's extremely interesting. Well, I mean, first off, shout out to Daniel and Liz. I love Dose of Dizzy podcast. They do a great job. And I think that one of the things we talked about was like, you know, when you have like something that you're podcasting about or creating content that's very, very niche, there's not a huge addressable market per se, but the market that does exist is extremely hungry for more content because there's so little content that is that specific, which I think is just kind of an interesting, you know, like trend to be observing in general. But, you know, with regard to the whole explosion, and it kind of feels like that in terms of the interest around vestibular, what I'm kind of curious about, because I heard the same thing after that St. Louis AAA, was that the grand rounds for the vestibular grand rounds was very well attended, and it was dominated by young people. And I'm curious of like why that is. And you kind of got to, I think, part of it, which is, you know, I think there's maybe more the science in the field of that has matured more. The technology has gotten better. So, you know, diagnosing and treating vestibular symptoms might be just naturally getting better. Again, this is kind of a nascent profession. And and that's, I think, an even more nascent subset of the profession is, even though it's been around, to your point, it's really only recently, it feels like, garnered the same level of interest as like the outer ear disorders or the middle ear disorders. And so I find that really interesting. But I know another area that you're very, well read and researched and you do a lot of presentations on is around student debt. And I'm wondering if there's a correlation there. Basically, do you think that students are sort of reading the writing on the wall and saying that the viability and sustainability of just being a, call it an audiologist that fits hearing aids primarily, is that sort of a risky endeavor to assume a whole bunch of debt and risk, whereas maybe it's safer to really become a full-blown clinician that is a medical professional that has more sustainability around a differentiated skill set like the vestibular diagnostics and treatments that are going to be maybe harder to disrupt. That's my own sort of sense, but I'm curious to get your take on this. Is there maybe an element of that as to why you're seeing this huge uptick in the interest around vestibular?
I think that could definitely be the case. So the entire time I've worked here, I've also taught amplification classes, which I always talk about like these two very different subjects. Right. And, when I teach AMP1, especially AMP1, where they're first coming in and, people see, the issues about OTC hearing aids. And that was a concern even before, they came out last year. Like that has been a concern for a while. We're right. Like, are we going to have jobs? And I'm like, you will absolutely have a job. Regardless of what happens with hearing aids, you will absolutely have a job because, anything that's available over the counter is not going to fix everybody's needs. And, and even if you don't go that route and you want to go a diagnostic route, that's really where we get paid is on our diagnostic. And so, I think that also, there's this financial component, but I also think there's this, sophistication component is that, you're spending more time and energy and financial, resources to become a doctor of audiology. And how do you raise that bar of what you are as a professional and what can you do that is, high level? And, I think that, and I would hope that that's really, a driving force is that people want to do gold standard care. And we know that that doesn't happen across the board, but that should always be the goal. And I think that vestibular is an opportunity to address some of these high level things in a way that isn't the same as, just doing hearing tests and doing repeated hearing tests over time. I always address, vestibular in, my intro vestibular class, like day one. If you like puzzles and you're the type of person that likes to put pieces together, then you will love vestibular because that's what you're doing, is that you're taking all these pieces and putting it together. And I think that that's one place where vestibular really shines in that kind of complex synthesis aspect where you're putting a lot of pieces together. And audiology is super important for that. I know Devin McCaslin had done some research when he was still at Mayo, looking at their AI system, their AI triaging, and, having audiology at the start of the vestibular path was really important in triaging patients effectively, because, patients going to ENT, if they're a migraine or ENTs don't want to see them. So, audiology really does have a great place in this model of vestibular. And I also think the other thing that's helping with vestibular is that there's more of people like me out there at other universities. Right. Back in the day, there weren't that many. And so, vestibular was either being taught by somebody adjunct, or they were being taught by maybe the electrophys person, maybe the low man on the totem pole who was like, you don't want to teach this, you're new, that's the course you teach. And that absolutely has an impact. But now, I think about this teaching at other universities, and there's more and more people who are truly interested in vestibular teaching at other universities and imparting that love for it. If somebody's teaching it really dry, and vestib is not easy. There's a lot of things that it's like, well, it could be this, but you have to look at this component, but it could be that. And so if you don't have somebody who's really good explaining it, then it just seems a bunch of gibberish, and it's not as effective. So the more of us that are out there that are like, look, here's how you put it together, here's why it's so important, I think also drives that. So I think there's a number of factors that are really playing into it. And I also think there has been an uptick in some of the accreditation requirements to teach it. So that also helps.
Yeah, I agree with that. It's probably multiple factors that are influencing the, sort of the like gravitational shift that in that direction. I just think about sort of, the existing marketplace. The number one thing that I hear whenever I talk to owners of private practices, or really like anybody that's in any kind of capacity where they need to hire people, that's like their number one challenge these days is how do you find good talent? And so there's a lot of like really interesting innovation happening around upskilling, front office assistants and stuff like that to be audiology assistants and all. But I think that, that's one thing. I think where I'm going with this is that, again, if I'm kind of putting myself in the shoes of somebody that's just entering into the workforce or is considering going into this workforce, is that there's a lot of existing practices that probably really wish they had some sort of vestibular offering. So not only are you in demand because there's sort of a labor shortage, but if you can have specialty expertise, not necessarily just vestibular, it could be with tinnitus, it could be with, APD, like whatever you choose to sort of specialize in. I think there's just a lot of value in that. If you want to kind of like join an existing practice or something like that and, kind of work your way up to maybe where you want to own your own thing or do your own thing, be your own boss, whatever. But I just think that if you're already going to be kind of incurring the debt, I think that it makes a lot of sense to think about your, sort of your value in the marketplace when you enter and how can you increase that value. And if you look at it from the perspective of what is there a shortage of, there's a shortage of labor, but more importantly, a shortage of the specialty type labor that you would need as a practice owner. And that's where I think that this could be kind of a saving grace for a lot of the existing practices that are sort of facing this, whether it's like managed care or whatever it is, these different things that are kind of eating into their bottom line. I just feel that this macro trend of diversification into ancillary services and offerings has been something that's been a big focal point of discussion within the industry for a while, but it feels more tangible and real than ever, especially when you kind of see how the young professionals seem to almost be realizing this writ large.
I agree. And I agree with you that any specialty, whether it's, tinnitus and NAPD are really interesting because, there is such a need for it. And the advantage to it is that you need very little, if no extra equipment than you already have. That's one place where vestibular is a little cumbersome in the amount of equipment. If you want a really high-tech vestibular lab, that can cost quite a lot. And I don't think you need every piece of equipment that's out there either. And that could be a whole other subject. But, I think that, those other, I definitely think, having a specialty, and that's not saying that you're not going to do anything else, but having those extra skills does make you very marketable to, to other businesses. And, even things like we're seeing like, this increasing talk about like pediatric tinnitus and misophonia and hyperacusis. And that, I think that'll go through the same explosion like vestib pediatric did, because you're starting to hear the small discussions about it. And it's one thing that hasn't really been addressed. So yeah, I think that having these specialized, talents, is beneficial to placing yourself in a more, financially better position, in a role, or, giving yourself a new opportunity to really expand things. And the more you have that expertise, the more you can expand upon it either through presentations, through, consulting, where you can get independent financial gains from consulting gigs. or jobs where you want them.
Yeah, I couldn't agree more. I mean, I've seen it. And I think that, again, it's kind of the same thing as the putting yourself out there, volunteering, advocating, and just getting involved. It's similar where as soon as you sort of start to develop these skills that are in such high demand, word gets round and you find yourself having more opportunities than maybe you thought initially. So again, it's not to say, like, to your point, it's not like it's going to be your only focus. I just think that you recognizing that that's something that there's true market demand for is I think a helpful remedy to the fact that you're probably, as a young person today, given today's realities, you're taking on a lot of debt. So you need to be really conscious of, like, how are you going to kind of work through that? And again, for me, I just see that as being something that feels kind of like, a safe position is go and get that specialty experience. So with the pediatric vestibular side of things, I found this to be really interesting. I was at the Missouri Academy of Audiology meeting, and I can't remember who the speaker was. I was actually sitting next to Liz, who was kind of giving me like a, tell it to me like I'm 10, kind of Cliff Notes version of what was being presented on. But like my main takeaway was kind of to your point, that is only getting started with what is being discovered. I think they were citing a study that was being done somewhere in Northern Europe, where they were talking about, some of the different pediatric procedures from a diagnostic standpoint that they were doing around, some of these newborn screenings, more or less, for pediatric vestibular diagnostics. So can you just kind of shed a little bit of light on what's happening in that space and why it's exciting?
Yeah, so what I'm guessing is they were probably talking about the Flanders study that's happening over in Europe. So they were looking at newborns who failed their newborn hearing screenings, and they were following up with them to establish, vestibular function, because there's a very high correlation between, newborn hearing loss, sensorineural hearing loss, and, the presence of vestibular disorders. And so, they created basically a protocol looking at these newborns who failed their newborn screening, and they're finding these early vestibular losses by doing them with them. And I would love to implement this too, because we talked about this. The American Balance Society has journal clubs. And this came up in one of the journal clubs too. And, how can we start to establish? And I think Kristen Janke over at Boys Town has started to do this too, the newborn vestibular screenings. And being able to catch these kids really young and get them into, physical therapy, because that's usually what we see. Kids who have congenital, hearing loss and vestibular disorders, they tend to lag behind on motor milestones. So they tend to crawl late, walk late. They tend to have more problems with things like riding a bike, doing gymnastics. So getting them in physical therapy earlier to work on that muscle coordination and, getting them, more on target with those motor milestones is important. But yeah, and I see pediatric patients. The youngest one, I haven't done any of the newborns, but the youngest one I've done was about 13 months. So I've seen them pretty young. And it's really interesting testing that population. And like I said, when I was in school, nobody did that. So
Right.
It was very rare. People did, but it was pretty rare. And a lot of it was in the U.S. I have to give kudos to Violette Lavender, who in
That's who gave the talk.
Who really? Oh yeah, Violette is amazing, and she really has talked about pediatric vestib for a long time. And at Cincinnati Children's, they were doing it, but most other major pediatric hospitals were not. Devin McCaslin and I did a talk for Cook Children's, and I think it was like 2015, talking to them about starting a vestibular program there. And I know they do it now there. But 2015 is not that long ago. And, at that time, most children's hospitals didn't have it. So that is such a young component of vestibular that has really evolved over time, and trying to establish what norms are for young kids. And really knowing what's going on with them and the pediatric disorders that are related to it. So yeah, it's definitely an interesting place. And I also tell my students, before all the pediatric audiologists were like, okay, we have our blinders on and we have, hearing loss, hearing aids, cochlear implants. And now it's really expanded. So I talk to my students, I'm like, if you want to do peds and you have vestibular, you have really created a great niche for yourself.
Exactly.
If you want those two specialties together. So it's definitely an interesting area of growth in our subspecialty.
Yes, that you explained it well. That was the study that I was referring to and the speaker that I was referring to. But I agree. I think it's just another testament to how young this whole field of science is, and I think it's exciting in that regard because it's like, it's to your point earlier about the jigsaw puzzle. I mean that's I've heard a couple people just describe audiology in general like that. It was, I think, Jill Davis that was describing it that way. And she was saying that, like, kind of having this rounded experience of having at least a semblance of knowledge of every facet of audiology kind of helps you to piece together for some of these more complicated cases of what's going on. And I just think that, like, even if that's a small addressable market for the, like, obscure disorders, if you will, you're still branding yourself within whether it's your practice, the hospital, whoever in the community of, like, you go here for anything that's related to this. If they can do something that is this extreme, then certainly they're a jack of all trades for every kind of ear-related disorder. And so I think it's just kind of like, it bodes well for the way that you're being perceived by the community around you and I think that's really kind of like the task that audiology needs to rise to is how does it almost rebrand itself as a whole to not just be immediately connotated with the hearing aid doctor and the doctor and instead be one that is like for everything related to, from amplification to inner ear disorders. That's, I think, kind of a tall order, but that's, I think, where the profession really needs to go. And I hope, like, with AAA, with some of the stuff that you're doing, and maybe this is a good segue of, like, year 2024, we still haven't had MASA and the different iterations of it passed. Like, what's on the big agenda for the organization and what's the goal right now, in terms of what does 2024 look like and what are your key goals that you want to communicate here?
Yeah, so the Medicare Access Improvement Act, that's still on the agenda. It is a pressing issue. I think the downfall is the state of Congress and just everything that's happening on Capitol Hill. But I think our goal is still that we need this direct access, that we need these patients to be able to come to us. To have, this reclassification as a practitioner, without necessarily expanding our scope, to just be recognized that we can do these things, we can do treatment, we can see these patients effectively, we can refer when it's necessary. That's going to be a main goal. And that's one thing that all three major organizations have really, come together on for the past several years of this one particular bill. Because I will say, like, before it was MASA, now it's Maya. When all three organizations had different bills up on Capitol Hill, it was really crazy going up there because I love advocacy and I love going up to Capitol Hill. And we do a trip with our students every year to go up to DC and have them advocate on Capitol Hill. And you'd be up there and you would go to an office and they're like, okay, so is this the AAA bill? Is this the ASHA bill? Is this the ADA bill? And they're like, oh, but ASHA was just here last week, and and then yesterday ADA was here, and so it was just, and we were all asking for different things. It was like the epitome of the fragmentation of our profession that we sometimes see. So the fact that we're all on board with this one singular bill, and that it's back in Congress, both in the Senate and in the House. is a great thing. We're hoping that it can be, approved, voted in the law. I know. So being in AAA, the Academy staff has been really looking to see, what are some of the ways that it can get, passed in both houses, in both the House and the Senate. And I'm sure that ASHA and ABA are looking at the same things. And there is discussion amongst all three organizations. But that's definitely one thing that is still going to be pressing. It's just whether Congress can sort things out there with the struggles that they're having.
Totally. Yes. Okay. Well, that's hopefully, this will all pass under your tenure, and you can
hopefully
another feather in your cap. So, as we kind of come to the close here, wanted to just kind of get a sense from you, in terms of what types of, you had mentioned, some of the work that you're doing from a public health standpoint, which I think is also really interesting in light of the Achieve study, and I think just like you see it on the news now, like all the time about, first it was with OTC hearing aids, which however you feel, it's exposure to the fact that there are, more people becoming aware of like these things and these are different options, which surprisingly, you looked at if you see the HIA, numbers of the number of hearing aids that were sold this year, this was like a blockbuster year for the RX professional market, the same year that the OTC hearing aids were released. So I think it's interesting that maybe as a weird byproduct, if you will, all that exposure actually led more people to go see a medical professional, which maybe that's kind of the way that this whole thing plays out, is that you do have a do-it-yourself market, which is fine, and that's great, but more people are encouraged then to come and see the professional and have the more prescription, experience. But I'm just kind of curious to get your thoughts of how does audiology from a public health standpoint make itself more aware or make itself more, I guess, well received by its fellow medical professionals, of its role here, of in the broader public health sphere, of why hearing loss is something that needs to be taken seriously from a comorbidity standpoint, from an allied medical professional standpoint. I'm just curious to get your thoughts, because I know that's another area that you do a lot of work is on the public health side of things.
Yeah, so I'm in the middle of my MPH. I'll be done. My master's of public health, I'll be done in May. And it's been really an enjoyable experience, like learning things that are, not audiology, but are audiology adjacent and applicable to audiology. And, I have to say that overall public health has been creeping into the healthcare sphere as a whole. You never heard young people coming in, because I'm the admissions chair, so I get to see everybody's, admissions packets and things like that. And you're seeing now more people talk about like social determinants of health and health disparities and health equity, and those discussions weren't really happening that much. And I think that they're still somewhat fringe in audiology. And I think that's where we need to really take a look at ourselves and see, how is hearing care access part of, health equity, or is it not? And, are people receiving the care that they should? And OTC is a great example of a public health, consideration. And so I always get nervous when people ask me about, I don't really get nervous, but, I think it's also, there's always this tenuous discussion about OTC and, where it really fits in audiology. And, you have the audiologists who are very concerned about, their business and their, livelihood. And that's an absolute concern. Mm-hmm. But when you look at, health disparities and the people who can't afford that access to care, how does that fit in? How are we addressing the hearing needs of people who have these health disparities because of, factors like race and socioeconomic status and, all of these, education level and all these other factors, and them not being able to access that care because in many cases it can be not at an affordable price point. And I think that's going to be a struggle. And I think overall healthcare, and that's not just us, that's, glasses, that's dental care, that's a number of things. But I think to start thinking about, beyond ourselves. And I think that's hard. Nobody wants to take a pay cut. Everybody wants to be able to make sure that they can have food on their table for their family. They went to school, and this is where that student loan debt comes in. You put in all this time, energy, student loan debt. You want to make sure that you can recoup that and make a living. But I do think we need to think about how audiology can be more accessible to, those who are experiencing health inequities in their daily life. And I think that that's going to be, something that I think that the future generations of audiologists need to really consider. And so, I'm adding in to our curriculum here more about public health, just because it's an area of interest of mine, but thinking about that of what are we able to do? And with the OTCs, there's been this, positioning of those products where I think that, they weren't rock bottom prices, or the ones that are rock bottom prices are not stellar products.
Right.
So we start getting into kind of these higher level OTCs, and then you compare that to cost of care with an audiologist, they tend to be, not that far off.
Right.
So, I think that has somewhat helped, with the growth of hearing care with being provided by audiologists and products being provided by audiologists. But I do think we have to consider, as a profession, the impact of health inequities amongst the residents that live around us.
For sure. And, one of the, I think, most interesting, opportunities, I guess, with regard to this, that I've come across on the podcast is, one audiologist is only one audiologist. And, well, what is the audiologist in essence? It's like a body of very specific institutional knowledge that was hard-earned. And so I think that what's very encouraging is hearing about some of the ways that, different audiologists are taking it upon themselves to sort of be the epicenter within their community, and however you define that community, to be the arbiter of that information and then disseminate it to other allied medical professionals. So I've heard some people talk about how, there's like these programs where they're working side by side with an occupational therapist and with a physical therapist, with geriatric care, working with, in the more medical setting, working with the cardiologist, working with the nephrologist, working with some of these different people that they're not going to be the audiologist, but they're going to be an advocate for you, and they're going to be helping to make sure that that information is passed along. And I think that, like, one of the things I've really realized as I've been in this industry is the concerning lack of knowledge by the general medical population, like, just basically anyone from a physician on, that isn't fully aware of the full scope of the audiologist's role, where they kind of come into this whole thing. And so I just find this to be interesting that, like, it's, I just think that from a public health standpoint, there's a lot there in terms of extending yourself so that, you can solve the bandwidth issue by having these ways that you're extending all this information that you are the hub for. And it doesn't, I don't think that it diminishes the audiologist anyway. If anything, it dramatically elevates them because they become perceived in their community as the expert for all these different things. But that to me is like I had Frank Wardinger on as a guest not long ago, and he was doing a program around, his whole business is around hearing conservation. And one of the things he does on the side is this whole KAOC thing. So he's training occupational therapists. He is trained over, like, I think it's 7-10 years. I can't remember how long. He's trained like 10,000 KAOC certified occupational therapists. I could be getting these numbers wrong. It was, I need to go back and check the record, but it was something dramatically outsized like that. And those were the kinds of things where I'm like, when we talk about accessibility and how you can really only control what you can't control what's going to happen on Capitol Hill. You can advocate for it and you can try to make a difference there, but you can do things sort of within your power. And those seem to be some of the things I've heard recently that give me a lot of, like, hope, is like man, if every audiologist was able to sort of impart at least a level of that knowledge to, say, 10 people, you just grew the workforce more or less by 10x in some capacity.
Yeah, we are such a small profession compared to pretty much all the other, big players, PT, OT, speech, optometry. Like, we're really small. And, you think about how many audiologists there are across the country that, somewhere probably around 14, 15,000 people versus, some of the other ones that are, 200,000
right.
Providers. There's only so much you can do as a singular individual seeing the patients that you see. And that's one of the things that I really like about public health, because you're thinking about, beyond the patient that's sitting in front of you. But yeah, the other professions know so little about us, and, having those relationships. I know in the vestibular world, we work a lot with like PT and OT because of that nature. I have we have an interprofessional fall prevention clinic, and, I show up with some of my vestibular equipment and we're looking at eyeballs, and optometry is like, why are you guys looking at eyeballs? We're in optometry. And we're like, well, we're looking at a different thing. We're looking at the VOR. We're not looking at, visual acuity. And so it's an opportunity for them to learn, like what we do versus what they do, and guest lecturing for optometry as well. But, it's funny. I took an advocacy class that was an elective in my MPH, and, professors, all about health policy. And, I talked about, one of the projects I was talking about was the MAIA, the Medicare Audiologist Access Improvement Act, and, and why we needed it. And, I brought up something about hearing aids, and they're like, well, it's covered by hearing aids. And I'm like, no, Medicare doesn't cover hearing aids. And this is, and everybody was like, what?
Right.
Why? And so even just basics like that, people don't understand until they're in that position where they need Medicare or their family needs Medicare, and so, yeah, we definitely need those other professional, connections to help us understand, where we can, take things like, so from a policy perspective, where can we go? We need that support of other professions. And just really being aware of how small we are,
right.
And how many patients really are out there. And I think, when you look at that PCAST report that came out that kind of was this catalyst towards OTC, one of the issues was, affordability. But if you really look at that, it's really about access too, and how few patients have access to, audiologists, either because of financial or because of just location, like rural aspects, and just how few audiologists there are. So we have a lot of opportunity to expand our reach through, various different mechanisms between education of our colleagues, policy, all sorts of avenues that we can go down. We just need people to think about it.
I know. I mean, it's like, again, to just kind of like, close the loop on this whole conversation, I think, you have, I think audiology has such a incredible opportunity here, because think of the equation here and how much better off it is this way rather than the opposite, which is you have a shortage of labor, which is bad for the public, but it's good for you as the professional because there's a ton of demand, and there is a lot of demand. You have an aging population that's becoming more educated on the various roles that the audiologist plays. And then you have all of this stuff that's happening now from a public health standpoint, looking at the larger, broader impact of, what hearing loss ultimately might sort of be tied into. And I think that, just looking at the big picture here, it's like, it's never been more needed by more people, and there's just not a lot of people that do it. And so I think that while it's concerning about, there's obviously a lot of concerns with the debt, and as a young professional, like incurring all that. And I don't know how this all shakes out from a from like a business standpoint in terms of where the revenue generation is going to come from in 5 years, 10 years from now. But I think it's undeniable that there is like this market demand for this kind of medical professional. And I think that it's got to be really exciting from that standpoint of like, really in many, many ways, I don't think that audiology has like really come into its own. And it's exciting to think about what that would look like, because I think it's just becoming more and more obvious of how important this specific type of medical professional is to the broader, like healthcare ecosystem.
I agree. And I think that, we have a lot of work to do, but I think you're right. I think, they're watching the profession kind of freak out a little bit about OTC, leading up to it. And, this Chicken Little, the sky is falling. And I don't think that's the case. I think we have more opportunities, to rethink how we can impact our patients. And, the hearing aid is one small part of it. And I think going back to kind of everything we've talked about, we have a lot of opportunity within our specialties and watching those specialties grow and being able to, impact patients with hearing aids, with hearing care, tinnitus, auditory processing, cochlear implants, vestibular. Like we have so much to offer, and so much of what we need or what our patients need is being provided by us. We just need to, make sure everybody knows that. And, that we're providing the highest level of care too, is that we're all, on board with best practices and things like that.
Couldn't agree more with you, Tish. Well, thank you so much for coming on today. Where can people connect with you if they want to reach out and link up?
So, you can find me. So I am on LinkedIn if you want to find me there. I think it's under Tish Gaffney. You can find me if you just look at the faculty at Nova Southeastern University. I will become AAA president in 2024 in October. And, if you want to come to the conference in Atlanta this year, I would highly recommend it. You can track me down there. I will be there. And actually, this year, just to kind of side note, we are bringing back Trivia Bowl. So if any of you were around, 2014 was the last year of Trivia Bowl with Gus and Jerry. And I am bringing it back. I am hosting with Ryan McCreary.
Nice.
So that will be at the end of the week. So, to kind of have some fun before everybody goes home. So.
Is it audiology specific trivia?
So we are doing a mix. It's going to be audiology trivia and some pop culture kind of mixed together.
Cool.
So a little bit for everybody. And we're excited to kind of revamp, the trivia bowl from what it was.
Any other, I should have given you more of an opportunity to talk about this coming AAA, which will be, sort of under your purview. Anything else that you want to shout out about Atlanta and what we should expect? I'm looking forward to it.
So this will actually be Bopana Belishandra's year. I get to have New Orleans next year, but but both great. But Atlanta, I think, is going to be great. It's it's an easy place to get to. Sometimes the conferences can be in tough cities to travel to, but Atlanta is such a huge hub that it should be easy to get to. My favorites are always the grand round sessions. They're always, really interesting to hear what cases are going on. Last year they introduced some roundtable discussions. Those were actually really fun. I went to the vestibular one and, got to talk with other vestibular colleagues from around the country and kind of seeing what everybody was doing. That was a new thing that was added last year that's going to happen again this year. And then the Friday night party, which is a ticketed event, I think, is going to be at World of Coke. I'm really excited about that because the only time I've ever really been to Atlanta was I was invited to speak at the Georgia Academy meeting, and they had a snowstorm, and so everything was shut down. So I didn't get to really sightsee, but I'm excited to go to World of Coke. I've never been.
I've only been to Atlanta once as well, so I'm looking forward to it. And I'm very much looking forward to New Orleans in 2025.
Oh, I'm very excited about New Orleans in 2025.
I'll have to, avoid talking about that with AU because she still has PTSD from the 2020 New Orleans show that was supposed to be, or it was supposed to be in New Orleans. It got canceled. The AAA that never was, the one that she helped plan. So she still has like a little PTSD anytime I mention New Orleans.
I'll have to do something special for AU in New Orleans that year. I love it.
For sure. Awesome. Well, Tish, thank you so much. I've really enjoyed this conversation. Really enjoyed learning from you and kind of getting a sense of what you're hearing on the front lines with, at Nova, some of the career advice that you've given, and just kind of where the profession is going. So thank you so much. Thanks for everybody who tuned in here to the end. We will chat with you next time. Cheers.